Hey everyone, and a massive welcome to all the physiotherapy students tuning into this explainer. I am super thrilled to have you here today. Look, we are going to set the stage for a really deep scientific deconstruction of an absolutely core modality in your clinical toolkit, interferential therapy, or IFT. Our goal today is to really unpack the mechanics behind the two huge pillars of this therapy: frequency modulation and amplitude modulation. We're going to break down the physics, the physiology, and most importantly, the clinical decision-making that'll actually make you a master of this technique.
Okay, let's dive right into this. To really answer this core question, we have to recognize that we aren't just slapping pads on someone and applying electricity. No, we are dynamically manipulating electrical fields deep inside human tissue to literally outsmart the nervous system and target very specific anatomical zones. I know, it sounds a bit like science fiction, but honestly, it is pure applied physics.
Here is our roadmap for today. Number 1, the principle of interference. Number 2, frequency modulation and accommodation. Number 3, amplitude modulation and space. And finally, number 4, clinical application, FM versus AM.
All right, starting right off with Section 1, the principle of interference.
Before we can modulate anything at all, we've got to understand how these medium-frequency alternating currents actually interact when they cross paths deep inside the patient's body. Let's look at the math for a second. IFT uses two medium-frequency currents, right? So say current 1 is humming along at 4,000 Hz, and current 2 is set slightly higher at 4,100 Hz. When these two meet deep in the tissue, they don't just sit side by side. They actively interfere with each other. By simply subtracting that 4,000 Hz current from the 4,100 Hz current, we get a difference of exactly 100 Hz. And that difference, that's what we call the beat frequency, or the amplitude modulated frequency. So instead of just irritating the skin on the surface, these medium frequencies totally bypass that skin resistance and produce this brand new low-frequency therapeutic current deep within the muscle and nerves.
And this brings us to a really fundamental rule of physics, the principle of superposition. You see, every electrical current produces an electric field, and these fields are vectors. That just means they have both a magnitude and a direction. So I want you to mentally visualize these vector arrows dynamically crashing into each other and combining in real time inside the tissue. Whenever electric field 1 and electric field 2 meet, they combine. Literally, E total equals E1 plus E2. This creates an entirely new resultant therapeutic vector. And modulating this resultant vector is pretty much the basis for everything we do in IFT.
Which brings us to Section 2, frequency modulation and accommodation.
Let's see how all this builds into the time domain by exploring our first big variable, frequency modulation. Now, frequency modulation simply means we are changing that beat frequency over time, while keeping the interference field in the exact same physical location. The stimulation changes, but it doesn't move. So if you picture this like an animated graph, you'd see the wave actively compressing and expanding as it sweeps from, say, 80 up to 85, 90, 95, peaking at 100 Hz and then sweeping all the way back down. And it does this without ever changing its location in the tissue. This continuous change over time is called a frequency sweep. But why do we actually do this?
Well, the absolute crucial point here is understanding the physiological problem we are trying to solve, which is accommodation. Nerve fibers are incredibly smart. They adapt really rapidly to constant, boring, unchanging stimulation. If you just blast 100 Hz continuously, after a few minutes the patient is going to feel less and less stimulation. The therapy basically loses its punch. Frequency sweeps are engineered specifically to solve this exact issue. By continuously altering the frequency, we keep the nervous system guessing, which completely delays that accommodation.
On top of that, different nerve fibers respond best to different frequencies. Lower frequencies are fantastic for muscle contraction and motor stimulation, while the higher frequencies are better for sensory stimulation and pain relief. So by sweeping through a whole range of frequencies, we aren't just delaying accommodation, we're actively recruiting different populations of nerve fibers throughout the entire sweep. It's like hitting all the right notes, making the overall treatment significantly more dynamic and effective for the patient.
Okay, so we've solved the problem of time. Let's move to Section 3, amplitude modulation and space.
We mastered time with frequency modulation, but what about the physical space inside the body? Remember our vector physics from earlier? Electric field vectors depend on two properties: magnitude, which is the overall strength, and direction. Amplitude modulation means we are changing the strength or amplitude of just one of those interfering currents. When you gradually dial up the intensity of current 2 while keeping current 1 completely constant, the resultant vector, that combined therapeutic field we talked about, actually tilts toward current 2.
It changes both its magnitude and its direction. So I want you to vividly picture the classic 3D interference clover leaf pattern. When two equal currents intersect, vector addition produces these four distinct lobes of maximum therapeutic field. This is exactly where the vectors reinforce each other perfectly. But when we apply amplitude modulation, those four lobes don't just sit still. Because the vector magnitude and direction are constantly changing, visualize those four lobes dynamically rotating, expanding, and sweeping back and forth like a radar scanning inside the tissue. We call this movement a vector scan.
And this right here brilliantly illustrates the massive difference between a static setup and a dynamic one. With static interference, your currents are exactly equal. The center remains entirely fixed, and you're basically treating a very small, highly concentrated area with zero movement. But with dynamic interference, which uses that amplitude modulation, the amplitude changes continuously. The center shifts, that therapeutic field sweeps back and forth, allowing you to cover a much larger treatment area without ever physically moving the electrodes on the patient's skin. It's a total game changer.
All right, let's wrap this up with Section 4. Clinical application, FM versus AM.
Let's bring all this complex physics directly back to your patient. Walking through this high-yield comparison really definitively locks these concepts in. Frequency modulation changes the beat frequency. Its primary effect is preventing nerve accommodation, and it operates strictly in the physiological time domain. On the flip side, amplitude modulation changes the current amplitude. Its primary effect is producing that dynamic vector scan, actually moving the cloverleaf pattern, and it operates entirely in the spatial tissue domain. It's literally time versus space.
Let's do a couple rapid-fire clinical scenarios so you can see how this works. Scenario 1. A patient comes into your clinic with a highly localized, super-specific trigger point. What do you do? Well, the solution here is to use static IFT. Because the required treatment area is very small and precise, you want that interference field to remain perfectly still, sitting right on top of that specific tissue lesion. You absolutely do not want a vector scan sweeping away from the target here.
Now, scenario 2. A patient presents with diffuse, widespread low back pain. This time, a static field just won't cut it. The solution is strictly amplitude modulation. You need that vector scan. By dynamically altering the current amplitude, that cloverleaf pattern sweeps all across the tissue, effectively stimulating a much larger area of non-specific pain. You get way better coverage and, honestly, vastly improved patient comfort.
And scenario 3. You are setting up a standard 20-minute treatment session. The solution here absolutely demands frequency modulation. Think about it. If you run a constant frequency for 20 minutes, the patient's nerves are going to accommodate, and they will just stop feeling the therapeutic benefit. Implementing a frequency sweep ensures that the targeted nerves don't simply adapt and ignore your therapy over that extended duration.
So by mastering these properties, manipulating time with frequency sweeps, and manipulating space with vector scans, you are taking complete control over the therapeutic environment deep inside your patient. Which kind of leaves us with a pretty provocative thought to end on today. If we can mathematically manipulate electrical fields to literally outsmart nerve adaptation and scan deep tissue volumes without moving a single physical electrode, what other physiological barriers could dynamic electrotherapy overcome in the future of rehab? Definitely think about that as you head into your next clinical rotation. Thank you so much for joining me on this explainer, and keep digging deep into the science.